Good evening, hi. I'm Dr. Kelly Burkenstock, owner of Skin Body Health in Mandeville, Louisiana and New Orleans, Louisiana. We're also licensed in Alabama and Florida, and we serve a lot of our clients nationwide through Zoom or FaceTime or other means of conference calls. Tonight what we're going to be talking about is taking the taboo out of Botox, a review of the facts and the myths, where we started with Botox and where we're at today. If you haven't heard of this before, please go to our YouTube channel, Dr. Burkenstock Skin Body Health. We've been coming online for several years, and we talk with you guys about everything from anti-aging, hair restoration, menopause, vaginal atrophy, erectile dysfunction, male menopause, and what you can do about it, and also about skin, Botox for ladies, Botox for men, fillers, lip plumpers, and a whole variety. So wonderful longevity for your gorgeous and wonderfully imperfect life. Because life isn't about being perfect, it's about being perfectly imperfect. So, if you have missed this, our YouTube channel is Dr. Burkenstock Skin Body Health. Please like and share our video so that we may reach more of your family and friends and just spread good educational tips and what's coming in your future and cutting edge technology for you, your family, and your friends. So, taking that taboo out of Botox, let's review the facts and the myths. So, Botox injections have become increasingly popular. The American Society of Plastic Surgeons guesstimates that there are over 4 million patients nationwide that are enjoying the benefits of Botox. Most of these are cosmetic, but some of these are medical, and we'll tell you a little bit more about that. What we have seen a change in is that we're seeing a more tempered Botox, a more natural Botox, sometimes called preventative Botox or even baby Botox. Well, this is becoming because we're using less Botox to achieve more, and I'll tell you a little bit about that. What's happening is it's becoming destigmatized on the social media platforms because people are doing a lot of selfies, and they're also using a lot of those apps with filters and facial modifications, and they're wanting to be a more perfect self. This can come with some positive effects, but certainly some negative too, because you are beautiful just the way you are. Sometimes we like to enhance ourselves just a little bit, but we don't want to be somebody else or look for some unachievable perfection that you can't look like day to day in reality. So all the photoshopping and selfies are definitely changing things online. Botox was a once considered movie star secret, and all the celebrities were getting it. And when that trends first started coming out in the late 80s and early 90s, it was a frozen look, and it looked very unnatural, and it was extremely expensive. So, you'd see a person and their eyes weren't even moving, almost like a deer in the headlights stare. It wasn't a pretty look. It was a cloudy or celebrity look, and again, it's very, very expensive. So as time has come on or gone on, we have actually seen a decrease in the cost of Botox to the client. So it's become much more affordable for the normal parts of society. The cost has come down, and we're also doing it differently. So it looks much more natural, much softer. The millennials, what we're seeing, are prioritizing taking care of themselves at a much younger age than the baby boomers did. So these wrinkle melting injections are becoming just a normal middle class and commonplace, and the cost coming down has really helped it become affordable for many, many more. During the pandemic, we saw a further amplification of people getting desperate to look better with so many computer calls and phone calls and working from home. People were just seeing themselves on conference calls and such as they just never had before. Those computers and phone screens up close can be very not friendly. Today what we're finding is people want a softer look, like a J.Lo, rather than something like a Jocelyn Wildenstein. And for those of you who do not know, she's also known as the Cat Lady. And when you Google an image of Jocelyn Wildenstein, what you'll find is a lady that started out to be a very beautiful woman, and over the years, with plastic surgeries and fillers and Botox, has really become very animated and cat-like looking, which is not attractive at all. So people are going for the softer J-Lo look. It's not a perfect look in your 40s, 50s, and 60s, but it's a softer, mature look. So as we said, a lot of these Gen Zs and millennials, they're starting in their 20s and 30s with baby Botox. They just don't want those fine lines and wrinkling and furrows to develop. So they're sort of doing preventative or baby Botox. We're also seeing some ladies that are noticing that their family ages with deep furrows either in the forehead or between the eyes, and they see it in their aunts, sisters, cousins, and they don't want that same look. Figuring they're from the same genetics, they want to do some prevention and not have that happen. And Botox certainly will do that for you. You can inject into a muscle and keep it from actually becoming hyperactive and forming a wrinkle. If you've already got wrinkles, that's okay. It will make those wrinkles softer and less prominent as well. So, social media has really taken us from taboo to social sharing. The numerous selfies on all of these platforms have made it easier for people to compare and then despair over the little things that they don't like in their looks. But it is destigmatizing Botox and increasing the education over a once taboo subject. While online sharing has made it a more normal procedure, there has created some downside. Namely, young people, as early as high school and college, have a fear of missing out. Their friends are doing it, so they want to do it too, and they don't even need it. They're asking for this for Christmas and birthday presents, along with plumper lips and the such, and it might be just a little too young. The difference in baby Botox, well, when Botox first came out, I told you, they were going after that frozen look. They didn't want anything to move, and they wanted to absolutely turn back time to a ridiculous level when there was no movement in the face when somebody was 18 to 25, for example. So the doctors at that time were actually using 20 to 30 units or more per area of the face. So 20 to 30 units in the eyes, 20 to 30 units in the forehead, 20 to 30 units between the eyes or the glabella area. And what was happening was you were creating that stone-like cement look, not attractive whatsoever. Now what we're finding is that baby Botox involves using 20 to 40 units across the entire face. So what was used in one small area and another small area and another small area, which added up to many multiple units, anywhere from 40 to 70 units or more. Now with baby Botox or softened Botox, we're using 20 to 40 units of Botox across the entire face. Forehead, glabella frown lines, eyes, even above the lips and lower mouth to prevent that downturning of the mouth that can kind of happen with age. The result, when done right, a very refreshed look that doesn't appear frozen or unnatural. So, most of the patients in their 20s and 30s are using Botox to smooth out some very, very fine lines and prevent the formation of deeper ones, which of course, that can be achieved. But let's talk about what could go wrong. Well, while Botox is much less risky than filler lasts quite a long time, Botox is not always the miracle cure. Please proceed cautiously when you're starting young or old. I want you to look for a well-qualified and highly trained physician. If not, if someone has just taken a quick Botox class or an esthetician just learning the trade, it can be very risky. So, if they hit the wrong muscle, no, it won't permanently damage anything, but you can have severely drooping eyes or chin or a stroke-like mouth, and that's not very pretty. In the upper face, that will take 3 to 6 months to sort of fade back to your normal facial architecture. In the lower face, below the nose, those results can last up to 9 months. So you wouldn't want a drooping lip or a stroke-like look in your lower face. That can last up to 9 months. So overdosing with the dosage or injecting the wrong muscle can be very saddening and upsetting if you've got to wear that look for 6 to 9 months. Again, upper face, 3 to 6 months. With the long-term use of Botox, your muscles can technically atrophy, which in some cases is good if you've got a heavy brow or glabella furrow. If you stopped using Botox, those muscles would repair and rebuild. So, the concern that your body might get used to Botox and it would stop working, there's really little evidence to support that theory, and we really have not seen that play out over time, although it is possible. So while Botox isn't a permanent change in your face, if you're the bride-to-be or the birthday girl and you get bad Botox because you went somewhere that it was on sale or by a non-qualified or not really competent provider, you could wind up with droopy eyelids or a corner of your mouth that's leaning one way or the other, or eyebrows that aren't even. Sometimes we can do a little trick to re-even out the brows, but often there's not much we can do to fix those mistakes, and you just have to wait for it to wear off. If it's an eye that's drooping, we can prescribe an eye drop that would give a little improvement, but it's not going to erase the problem, and it's not going to make the problem go away. The issue would still be there. So even though it's temporary, sometimes several months is a really long time to wear a look that's uneven, especially if it's a special occasion like an anniversary, a wedding, or a special birthday event where you wanted to look and feel your very best with just a little bit more oomph and pizzazz. So let's talk a little bit about Botox, facts versus fiction, or the myths involved. Botox is only for the wealthy. Well, that surely has become a myth. You can get Botox anywhere from $250 to $900, depending on the clinic and depending on how many areas of the face that you're wanting to treat. So it has really become affordable. And you're purchasing, some people do it once a year for a treat, others every 3 to 6 months. That really depends on you and what you choose. You can only use Botox on the crow's feet, forehead, and furrows. Myth. There are many off-label uses for Botox. Bunny lines above the lips, lower mouth to prevent that pulling down, around the chin to give us a little lift. Also on the masseter muscles, which are the muscles that control the temporomandibular joint, otherwise known as TMJ. And if you've got that clenching going on, that TMJ pain, Botox can be a godsend. So that would be a medical use of Botox. We also use Botox for migraines all around the head, wherever your migraines are. Wonderful medical use of Botox, and it is just life-changing from those who suffer from severe migraine headaches. If you've got excessive sweating in the palms or the underarms, Botox can be used there to eliminate that problem for 3 to 6 months. And for those people who suffer with hot and sweaty hands 24 hours, 7 days a week, or they soil their beautiful clothes and suffer some embarrassment, that can be very comforting to make that problem go away, at least short term. Urologists, OBGYNs, often uses to reduce symptoms of an overactive bladder, so it can help with urinary incontinence due to overactive bladder contractions. It's also used for patients with facial imbalances or facial symmetry. So some people are born with a very asymmetric face, and you can actually change that and make the face more symmetrical with a certain Botox treatment. Also for stroke victims, we're often balancing them out if they've got a permanent lower side in the face that they've had from a prior stroke. So, and it just really improves their self-esteem, because it's something that nobody wants to look in the mirror and see an imperfect or an asymmetrical face, whether it was congenital, being born that way, or whether it was from a stroke thereafter. I do want to mention, before I finish, and we do have some more to go, tonight's special. So, if you book Botox with us, Dr. Burkenstock Skin Body Health, at either of our locations, You don't have to do the treatment now, but if you book and purchase your treatment before January 1st, you will get $100 off any area or full face of Botox. If you and a friend signed up together, that's $150 off for any area or full face for you and for your friend. So we hope you'll be able to take advantage of that Botox special. And again, you just need to book it and purchase it before New Year's Day, and you can have a whole year in order to use your Botox purchase. All right, let's move on. So we talked about it's not just for the wealthy anymore. We talked about it can be used over many areas of the face and neck and décolleté for cosmetic, and it also can be used for migraines, overactive bladder, excessive sweating, and other things from a medical position. Moving on. Botox injections only last a few months. That's very true. In the upper face above the nose, they usually last 3 to 6 months. In below the nose, neck, décolleté, it can usually last a little bit longer, anywhere from 6 months to a year. It's just different muscle groups, different nerves, and just reacts a little bit differently in the lower face. Botox is safe to use. That is completely a fact. Adverse effects are very rare and not serious. Years ago, when Botox first came out, there were some things going on that weren't ethical, and they're certainly medically unethical. They were using veterinary Botox, didn't know how to reconstitute properly, and other issues, and that's why we heard of some Botox issues way back in the 80s. That is not done today. There's only 3 approved FDA types of Botox. Botox, the brand name, Dysport, another brand name, and Xeomin, a third brand name. And I'm sure others will come on the market, but those are the 3 major ones. But yes, Botox is safe and very effective. Allergic reactions and complications are very uncommon. So, Botox paralyzes your muscles. That is a fact. So Botox botulinum toxin, purified botulinum toxin, it does work by blocking nerve signals to the muscle. So it diminishes or prevents the muscle from contracting. If you use a small amount, you're just going to weaken the muscle and make things very soft. If you use a large amount, then you're going to prevent the muscle from contracting at all, and that's when you start to get that stone look or cement look on your face. So we don't want to completely freeze out that entire muscle because that doesn't really look good. Botox injections can prevent wrinkles from forming. That is a fact. So if you're younger and don't have wrinkles yet, or very, very slight fine wrinkles, and you're having Botox injected by a professional, it will prevent that muscle from aging. If you've already had the wrinkles, Botox injections will absolutely still help. They will soften those furrows and wrinkling, and they will keep them from getting even more pronounced. So, I'm Dr. Kelly Burkenstock. We hope you will like and share this video. All in all, Botox is safe, it is effective, and it is an accepted procedure to help you age gracefully because you are so worth it. We welcome you, ladies and gentlemen, to sign up for our Botox special. As always, it's been a pleasure talking to you. Merry Christmas, and I wish you a very happy New Year.